Hi, I'm Jack Cush, Executive Editor of RoomNow.com, and this is the Week in Review as of Friday, the 11th of March. A few interesting items this week from the social media feed. Nurses' Health Study has actually shown that post-traumatic stress disorder is associated with a higher rate of incident rheumatoid arthritis. Hard to make out what that means. It's also been shown that PTSD is associated with a higher rate of smoking, but it turns out smokers and non-smokers who had PTSD had an equally higher rate of incident RA. Does trauma, does stress cause autoimmune disease like rheumatoid arthritis? An age-old question that this adds to somewhat. Risk of hospitalization associated with biologics is something we've often reported on. We tweeted this week about Ken Sag and Jeff Curtis and Yoon and Ten Buchelman and others who reported on their claims data analysis showing that compared to abatacept, etanercept, infliximab, and rituxan have a higher rate of infection when they're given as the second biologic. So these were 30,000 patients who had previously had a biologic, and then on their next choice, a higher rate of infection was seen with those drugs compared to abatacept, suggesting abatacept has a lower rate. An interesting finding. A recent report about the use of colchicine in France, although it's a bit dated, did show, interestingly, in this fairly large cohort of how they treated acute gout, that regardless of the renal function stage, patients were receiving the same amount of colchicine, averaging 2.8 to 2.5 milligrams to treat gout acutely in the first day, with not a lot of difference between CKD stage 1, 2, 3, and 4. And lastly, not surprisingly, aspirin does lower the risk of colon cancer. We know that, but a recent study shows it does not lower the risk of breast, prostate, or lung cancer. Other news items and features that were seen in this week. Today we reported on risk factors associated with pulmonary hypertension in lupus. This Chinese cohort-based study showed what was shown before, is that RNP antibodies in pericarditis is associated with a higher rate of pulmonary arterial hypertension. But they also showed other independent risk factors, including disease duration, interstitial lung disease, SSA antibodies, high serum uric acids with a low ESR, and interesting low disease activity, suggesting disease activity is not required to develop or progress with pulmonary hypertension. You may know, but you should know, that the ACR is inviting commentary on a guideline they're developing for perioperative management. You can go to our site or the ACR site to comment on that. Infliximab tocilizumab was in the news this week with a recent Lancet report, a big report because it's the first time report of a randomized controlled trial proving the efficacy of tocilizumab in patients with giant cell arteritis. Albeit a small study of 30 patients, it was randomized, and they did show that patients who received tocilizumab compared to placebo had more complete remissions, 85% versus 40%, and less relapses, 15% versus 80% on those on placebo, when they received tocilizumab. Everyone received high-dose steroids at the outset that was weaned over time. Not surprisingly, a high rate of steroid-related side effects were seen in both groups, although the tocilizumab group was able to get off of steroids more quickly. You're certainly aware that there are a number of drugs that may cause Raynaud's, and the best known amongst these are beta blockers, metoprolol, etc., and chemotherapy drugs, including bleomycin. But a recent sort of review of this topic shows that there are other drugs that can fall into this category. Clonidine, ergot alkaloids, bromocriptine, ADHD drugs, weight loss drugs, phentermine, vinyl chloride, and interferon are things to consider. Lastly, ixekizumab was shown in a clinical trial presented at an annual dermatology meeting this week to be superior to etanercept in treating over 2,500 patients with moderate to severe plaque psoriasis. They showed that patients with ixekizumab, the IL-17 inhibitor, had faster responses and better responses compared to standard doses of etanercept of 50 milligrams. So that's it for Room Now. Tune in. Hope you enjoy the site.